I grew up in East Tennessee. It was a really small town. I ended up going to school also in Tennessee, did my residency training in Florida, and then I ended up coming back here after I was on faculty at the University of Louisville for a while, and I really was excited to be back in Tennessee and be able to see patients here. I feel like when patients come in to see me, I really have kind of a better idea of what they're going through because unfortunately, right after I finished my training, and just like my patients, I was ready to have a family, I started trying to have children and was not able to do so. And ultimately, I did many of the same tests that I prescribed for my patient and many of the same treatments. Ultimately, I ended up having 2 children through in vitro fertilization. Even though it was a long time ago, I can really remember the anguish that I went through, the sadness, the stress, the anxiety, and you know, it really, at the time, it was really hard to go through, but it's really been one of those things in life that's been a blessing in disguise because I really am able to relate to a lot of the emotions that my patients have when they go through IVF. The thing I love about being a reproductive endocrinologist is we're able to see people initially at a time when they're going through a struggle. Many of them are very upset, very sad, and it's so rewarding to get to the end of that, whether it's a few months or a few years, and ultimately be able to see them and look at their beautiful baby on ultrasound and send them back to their OBGYN. That's a great feeling. I love that. So what I would be doing if I were not a reproductive endocrinologist is easy. I would be an artist. I don't know if I'd make a living at it, but I've painted and done watercolors my whole life, really since I was about in the 6th or 7th grade. And I love to do that on the weekends, so I would be a painter. Something that people probably don't know about me is I'm not very athletic, but I really do like to do exercise, and I'm up for kind of new activities. So probably about 6 months ago, I went spelunking in a cave with a group of girls, and I really didn't realize quite what a challenge it would be. I mean, it was like I was crawling between rocks. There was one area called the birth canal, and you had to go in backwards, turn, and your head had to come up, and then you had to pull yourself out. And I'll admit that was a little scary, but I made it through.